AIDS-defining clinical conditions. a.k.a. AIDS-defining illnesses or AIDS-defining diseases is the list of diseases published by the Centers for Disease Control and Prevention (CDC) that are associated with AIDS, and used worldwide as a guideline for AIDS diagnosis. CDC exclusively uses the term AIDS-defining clinical conditions, but the other terms remain in common use. This list governs the U.S. government classification of HIV disease. This is to allow the government to handle epidemic statistics and define who receives U.S. government assistance. However, considerable variation exists in the relative risk of death following different AIDS-defining clinical conditions. Definition. According to the CDC definition, a patient has AIDS if they are infected with HIV and have either a CD4 plus T cell count below 200 cells per microliter, a CD4 plus T cell percentage of total lymphocytes of less than 15%, or one of the defining illnesses. A patient presenting one of the above conditions but with laboratory evidence against HIV infection is not normally considered to have AIDS, but an AIDS diagnosis may be given if the patient has had pneumocystis jirovecii pneumonia and has either not undergone high-dose corticoid therapy or other immunosuppressive cytotoxic therapy in the 3 months before the onset of the indicated disease, been diagnosed with Hodgkin's disease, non-Hodgkin's lymphoma, lymphocytic leukemia, multiple myeloma, or any cancer of lymphoreticular or histiocytic tissue, or angioimmunoblastic lymphadenopathy, or been diagnosed with a genetic immunodeficiency syndrome atypical of HIV infection, such as one involving hypogammaglobulinemia. Defining illnesses. 1987 definition. Candidiasis of bronchi, trachea, or lungs. Candidiasis esophageal. Coccidioidomycosis. Disseminated or extrapulmonary. Cryptococcosis. Extrapulmonary. Cryptosporidiosis. Chronic intestinal for longer than 1 month. Cytomegalovirus disease, other than liver, spleen or lymph nodes. Cytomegalovirus retinitis, with loss of vision. Encephalopathy, HIV-related. Herpes simplex, chronic ulcer, S, for more than 1 month. Or bronchitis, pneumonitis, or esophagitis. Histoplasmosis, disseminated or extrapulmonary. Isis, chronic intestinal, for more than 1 month. Kaposi's sarcoma, lymphoma, Burkitt's lymphoma, immunoblastic, or equivalent term, lymphoma, primary, of brain. Mycobacterium avium complex or Mycobacterium kansasi, disseminated or extrapulmonary. Mycobacterium, other species. Disseminated or extrapulmonary. Mycobacterium tuberculosis, any site. Extrapulmonary. Pneumocystis jirovecii pneumonia, formerly Pneumocystis carinii. Progressive multifocal leukoencephalopathy. Salmonella septicemia, recurrent. Toxoplasmosis of the brain. Tuberculosis. Disseminated. Wasting syndrome due to HIV. Added in 1993. Cervical cancer. Invasive. Mycobacterium tuberculosis. Any site. Pulmonary. Pneumonia. Recurrent. Children less than 13 years. Additional conditions are included for children younger than 13. Bacterial infections. Multiple or recurrent. Lymphoid interstitial pneumonia or pulmonary lymphoid hyperplasia complex. History. In 1993, the CDC added pulmonary tuberculosis, recurrent pneumonia and invasive cervical cancer to the list of clinical conditions in the AIDS surveillance case definition published in 1987 and expanded the AIDS surveillance case definition to include all HIV-infected persons with CD4 plus T lymphocyte counts of fewer than 200 cells per microliter or a CD4 plus percentage of less than 14. Outside the U.S., however, diagnosis with a listed opportunistic infection is still required. It has been suggested that other conditions, such as penicilliosis, should be included in other countries. AIDS info. Petrokovich. A. Amo. J. Phillips. A. N. Johnson. A. M. Stevenson. J. Desmond. N. Hanscheid. T. Lowe. N. Newell. A. Abassi. A. Payne. K. Pym. A. Theodore. C. DeCock. K. M. 1998. Disease progression and survival following specific AIDS-defining conditions. A retrospective cohort study of 2048 HIV-infected persons in London. AIDS. London, England. 12. 9. 1007 to 1013. PMID 9,662,196. DOI 10.1097 00002030 19980900000007.